Order.
Out of poverty.
The Honourable Marion Street.
Thank you, Mr. Speaker. The Prime Minister has admitted that he couldn't live on the minimum wage. How does he expect anybody else to? How does he expect anybody else to live on the minimum wage? Mr. Speaker, 40% of children are in homes where the parent is employed, is in work. We are talking about the working poor as a developing group in our society, something that none of us ever thought that we would see happen. Chester Borrows has just said my generation didn't live in anything like the poverty we're talking about today, but my parents believed that education was the way out of poverty. Education was the way out of poverty. But I want to draw a couple of other things to Chester Borrows' attention. I want to tell them that the highest income earners in this country have seen an increase in their incomes, while at the same time middle income earners have seen a drop in the value of their incomes, and the least well paid have seen an even further drop. Mr. Speaker, poverty is real. We have a report that reinforces some of the causes, but also some of the effects of poverty that we know about. And I want to make the link between health outcomes and poverty, because it is not sufficient now simply to say, well, like my parents did, go and get a good education and you can drag yourselves up by the bootstraps. Let's take one example. In this report, Mr. Speaker, let's have a look at some of the connections between health and poverty. It says very clearly that children growing up in low-income households face multiple risks. So nobody starts from the same starting point. They say that these children are 1.4 times higher, have a 1.4 times higher risk of dying during childhood than a child from a high-income household. They're more likely to die of sudden unexplained death in infancy. They're 3 times more likely to be sick. Hospitalisation rates for these children are higher than from those for those from wealthier areas. They're at greater risk of contracting infectious diseases as these spread more easily, obviously, in houses that are overcrowded and inadequate. So these children start off way behind the starting blocks. That is not sufficient for the government to say we need to grow the economy by making businesses more productive. If that were the answer, I wish they had done something about it already. But that is not happening either. But even if it were, it would not be sufficient. There is an undercurrent of poverty in our society now that we have not seen for decades. We have certainly not seen in my lifetime. And one of the things that I find really disturbing about this report, Mr. Speaker, is that we are famous for being a food-producing nation. And it says poor nutrition is a significant problem in New Zealand. Why is poor nutrition a significant problem in New Zealand? We know that poor nutrition in pregnancy can lead to premature birth, low birth weights, childhood learning and developmental difficulties. We know that. And so they say we should have a child nutrition strategy. Now, we didn't have a complete child nutrition strategy when we were in government, but we went a long way towards it. We introduced fruit in schools, axed by this government. We introduced healthy eating, healthy action programs. Yes, come on, let's have the correction. Well, let's find out why it is that private companies are sponsoring fruit in schools. Private companies are sponsoring breakfasts in schools. They get really good advertising out of it, for sure. So we instituted fruit in schools. We instituted healthy eating, healthy action programs, which this government has axed. We have introduced tuck shop guidelines in school tuck shops. that made sure that school tuck shops only offered healthy options. And what did this government do? Cancel those. Mr. Speaker, the Prime Minister can't live on the minimum wage, nor can anybody else.
Louise Upston.